I always like to say that medicine chose me. I don't think I chose medicine, but I really like the idea of healing and being a healer. I always loved science and it felt like a really natural fit. I think pediatrics came very naturally to me. I think working with the population of children, it's really lovely, the attitude that they have. It's also lovely to carry children through different developmental stages of their life. It's an honor and it's a privilege to help families grow as well. I'm a pediatrician, but I have an extra interest. I did some extra training in pediatric dermatology, so I split my time between the two. So if you're coming to see me for a regular pediatrics visit, you can expect us to sit down and chat a little bit about the child. We go over some basic stuff like the vitals and how they're growing, and then we talk about your concerns, anything that you have. We do an exam, and at the end of it, I talk to you about some things I expect over the next few months, what you can work on with your child, and anything that I recommend. If you're coming to see me for dermatology, you typically sit down with one of my derm nurses first, and they go over a lot of the questions. By the time you see me, we kind of have your idea and your story sort of wrapped up. So I'll do a good skin exam, and then we'll chat about next steps. Teenagers are always looking for a way to be more independent, so I typically offer them some opportunity to chat to the doctor by themselves to ask any questions that they have. Obviously, we ask mom and dad's permission if that's okay first. It just gives them an opportunity to start practicing talking about their own health concerns with the doctor. I really appreciate being able to really guide parents through those nervous first few months with a baby. I also really appreciate, having children come back and getting to see how much our treatment has had an impact on them. Being able to kind of guide somebody through and have that follow-up, and you feel almost as if you become a part of their family as well, which can be very, very rewarding in pediatrics. Whether it's a short-term illness, that's a cough or a cold for maybe a week, that turns into an ear infection, or if you've got a diagnosis like psoriasis or something that's going to maybe be long-term for the patient, you should know that you've got a partner in me through it, and we'll work together to figure out the best treatment plan and options for your child.